Now recognize Ms. Luna from Florida for 5 minutes.
Hey everyone, rough day? Yeah, it's okay. My questions won't be that bad. Dr. Duane, how are PBMs antithetical to a patient-centered, consumer-directed healthcare system?
I think that if something was patient-centered, then by definition it would be looking out for what's benefit of the patient. But I think that you can look at, stockholder reports and just the placement of PBM companies on the Fortune's list of richest companies and know that whoever they are looking out for, it doesn't seem to be the patient.
I couldn't agree more. When PBMs provide contract terms to pharmacies like your own, are you able to negotiate the terms of the contract, or are you forced to take the terms presented to you?
No, I've tried to redline and scratch out terms that I don't agree with and add terms that I think would be mutually beneficial to myself and the patients, and they're universally denied. It's a take it or leave it scenario.
So you really don't have a voice?
That's correct.
How have PBM clawbacks, which occurred when PBMs charge a consumer a copay that is higher than the full cost of the drug and then claw back the extra money from a pharmacy, impacted your pharmacy?
It's tough to budget. I mean, it's just like anything else. We're a small business. When I get paid one amount of money and then months later have a very large proportion of that money clawed back, it's very hard to do business like that. It's very hard for me to forecast hiring and retention of employees, things like bonuses, benefits. It makes it almost impossible to do that kind of business.
So would it be safe to say that it makes it hard for you to financially plan for your business?
It would be very safe to say that, yes.
The state of Florida is leading the nation by recently signing into law comprehensive reforms that will increase accountability and transparency for prescription drug costs. This legislation institutes a series of patient protections to include prohibiting a PBM from forcing a patient to undergo step therapy or failing twice, i.e. the practice of forcing someone to restart a medication that they know doesn't work when they switch insurance companies. What impact will this legislation have on your business?
So I worked with the Florida legislation, the legislators and Governor DeSantis with this legislation, and it's going to be very impactful to my business and to the patients that I serve. I think that patients will be in a position to what they see is what they get. They won't have surprise billings after the fact. Also, we won't have surprise clawbacks after the fact. I think it'll save patients money in passing the rebates along to the point of sale and to lower their out-of-pocket. So I think that it's a very robust legislative package that the state of Florida passed that is going to do a lot of good for our patients in my business.
Do you think that this is a good model that we should replicate at the national level?
I think it absolutely is. I think that it eliminates spread pricing. It makes sure that pharmacies can be on a fair and level playing field, no matter if they're a small business or if they're a large conglomerate. So absolutely, I think it's a framework.
And just my last question before I yield back the rest of my time. In some instances, the medications that these patients are forced to have to go back and do again, are these medications to treat cancer and terminal illnesses?
Absolutely they are. Yes, we see that.
So it's essentially forcing someone to do something that they know it's not effective and could kill them.
That's correct.
Okay. Thank you, Chairman. I yield my time.
Chair now recognizes Mr. Conley from Virginia.
I thank the Chair, and I thank the Chair and the Ranking Member for having this very important hearing. I recently heard from a constituent